Welcome to www.texas.healthsourcechiro.com/city/Pearland. Today's topic, headaches can actually be dangerous. There are as many kinds of headaches as there are heads, more probably. Because they're internal and do their work in an area protected by the skull, they can be even more complicated to effectively diagnose and treat than many other forms of pain. For example, if you sprain your ankle, it swells up and looks funny. If you slice your finger, it bleeds a lot and then scabs over as it heals. Bruises, burns, and most other forms of injury have visible signs, often more than one. These help in locating and treating the insult to the body. These physical indicators mean that you can apply Band-Aids or ice or stitches. Visible injuries also provide for legitimacy headaches sometimes lack. Often the only actual evidence of your pain is that you're making a face and you look funny. This does not fall under the same rubric as gushing blood. Some headaches, such as cluster and migraines, can be sufficiently debilitating that they do provide a level of veracity to those not inside your skull. Turning white, throwing up, passing out, or some combination of the three tends to function as clear evidence of severe pain. Some headaches, again, especially of the migraine and cluster family, can have other side effects such as visual, auditory, or cognitive impairment, or even hallucinations. Many others are just really annoying. They can also be symptomatic of a larger problem. Migraines, for example, especially those with attendant dizziness, can be a sign or effect of Meniere's disease, which is a progressive inner ear impairment leading to loss of equilibrium. This and the other debilitating effects of headache pain can cause a person to lose temporary or permanently some of their functionality. For example, if you are prone to sudden debilitating migraines or cluster headaches, you may lose your ability to drive so as to avoid risking an accident. Some people have lost jobs to head pain or had other aspects of their lives substantially impaired. There are, of course, extreme cases. Most headaches simply cause pain on the level of annoyance. They may interfere briefly with our work or other functions, but do not substantially interfere with our lives. Despite that, headaches are not something we should necessarily have to deal with on a daily basis. This is especially true as one of the most common analgesics, acetaminophen, has recently come under review. Abuse of this product is prone to causing liver damage. While reasonable use of this painkiller is generally harmless, many people tend to abuse it on the principle that if 2 are good, 6 are better. The FDA is considering revising the safe dosage to reduce human risk. Another way to reduce risk is learn exercises and body mechanics, as well as engaging in treatments that help to eliminate the need for over-the-counter medication. Better still, such treatments and exercises can help to keep a situation that begins as needing a non-prescription medication from turning into something much more severe that requires narcotics. Additionally, such pain management can help to reduce or eliminate a need for prescription medication when it comes to dealing with some of the more severe forms of headaches. To find out more information on topics like this, please go to www.texas.healthsourcechiro.com/Pearland.